Hi, Dr. Regina Rodman here, and today we are going to talk about some of the risks with a tracheal shave. Now, first things first, we call it a tracheal shave. We are not actually touching the trachea at all. The trachea is actually the windpipe. What we are doing is an Adam's apple reduction, or what some people call a chondrolaryngoplasty, which is a fancy way of saying we are removing the thyroid notch from the thyroid cartilage. So we're not actually touching the windpipe, we're touching this area above the windpipe, which is called the thyroid cartilage. The thyroid cartilage comes to a little point in the front called the notch. We are removing that. Now, in the surgery that I do, the Adam's apple reduction, I am not changing the voice at all. There are surgeries that remove the Adam's apple and increase the frequency or the pitch of the voice. There's a couple different procedures. One is called a Feminization Laryngoplasty. That is a more complicated surgery, and I generally recommend going to a laryngologist that specializes in that kind of surgery if the goal is to change the voice at the same time. The surgery that I'm doing is just to reduce the cosmetic appearance of the bump in the neck, the Adam's apple. So the way that I do an Adam's apple reduction, I think minimizes some of the risks. The big risk with an Adam's apple reduction is a change in your voice, hoarseness, or difficulty changing pitch. Now, and usually that occurs either from damage to the vocal cords, or it can also happen from an over-aggressive Adam's apple reduction where too much cartilage is taken and the larynx is destabilized. Now, I am double board certified in facial plastics and otolaryngology or ENT surgery. I did a lot of laryngology in my residency training, so I'm really familiar with the voice box from kind of inside and the outside. But that doesn't mean that that doesn't make the risk zero. What I do when I do an Adam's apple reduction is I have the anesthesiologist, before they put in the breathing tube, show me the vocal cords with a laryngoscope that has a little camera on it so that everyone in the room can see the vocal cords. I then put a small needle through the neck, through the thyroid cartilage, to make sure that it comes out above the vocal cords. And I can verify this because I can see in the anesthesiologist's camera that my mark is above the vocal cords. I know where they are from years of doing this, but I use the needle to just kind of verify. Once that needle is in, then they put in the breathing tube and we start the procedure. Now, the second risk of an Adam's apple reduction is same as any surgery: risk of bleeding, scarring, and infection. The the Adam's apple reduction that I do an external approach, so there's always a risk of scarring. I generally can keep the scar pretty small, like a centimeter, maybe 10 to 12 millimeters. I put that incision usually in the area where the neck meets the chin, so it hides in a little crease way up high, minimally visible. Older patients, if they have creases in their neck, I put it in the highest wrinkle of the neck, and that usually heals really well too. Scarring, then what we do is I dissect down to the area of the Adam's apple, and then taking care of and being mindful of where my needle is, I know that it is safe to remove all of the cartilage above that point. So that helps me be as aggressive as possible in getting it nice and smooth, but without risking damage to the vocal cords. Now, even then, patients do usually experience a little bit of hoarseness for a few days afterwards. That's really more from the breathing tube being in the throat and kind of irritating the vocal cords. So usually the hoarseness is temporary. Patients do sometimes complain about a difficulty changing pitch afterwards. So they feel that their voice is normal, they can sing, they can speak, but sometimes they will notice that the end range, especially singers and performers, the end range is a little bit different, so they can't quite hit the high notes the way that they used to. That I have always seen be temporary, but it can last for a few months. I think that a lot of that has to do with not necessarily that the larynx is destabilized, but that the larynx is a new shape. So the voice box is a new shape. Plus, the muscles that help to rotate the larynx, that's how we change pitch, is the voice box rotates back and forth. Those muscles have been disrupted, pulled to the side in order to do the procedure. So they're a little bit swollen, they're a little bit angry, they're not working the way that they used to. So it does take a few months for everything to settle and kind of realize, hey, the larynx is a slightly different shape, but it still rocks, it still moves, and for those muscles to wake back up. So patients do, not always, but sometimes notice a change in their ability to change pitch and to sing high notes. I have always seen that be temporary, but it can take a few months for everything to settle and for it to go back the way that it was. The risk, of course, is that hoarseness or that change in pitch would be permanent. We talked about scarring. The other thing, not so much a risk, but most patients experience a little bit of difficulty swallowing. I think some of that is from having the breathing tube in the back of the throat and then manipulating the throat from the outside just kind of increases a little bit of the irritation in the back of the throat. So I tell patients if they do have difficulty swallowing afterwards, it's a little paradoxical to what you would think. Thick liquids are actually easier to swallow than thin. So if you're having a hard time swallowing, don't try for water. Try for like some applesauce or some like thicker soup or something that's actually easier to swallow if you feel like you're having a hard time. We do give patients a little dose of steroids to help with the swelling inside the throat, which tends to help a lot if they're having a hard time swallowing. But again, generally the difficulty swallowing is just for the first or second day. It usually goes away pretty quick. So those are the big risks associated with a chondrolaryngoplasty or Adam's apple reduction. And so I hope that was informative.